So that being said, what are some of the evidence-based group treatment approaches that you found to be effective?
Right. Well, in the United States, there are three specific types of group models. The first one, the most popular, is the so-called Duluth model, which is based on a feminist theory about domestic violence. Primarily, domestic violence is male perpetrated, and that women who are violent are only fighting back in self-defense. And furthermore, it assumes that psychological factors or um, issues such as substance abuse should not be considered very important compared to the need for men to maintain gender privilege and to use abuse as a way to maintain that status. Um, the other major form of treatment model for groups in the United States is the so-called CBT model, also known as cognitive behavioral therapy. My program falls into that particular model, and then there are a number of other types of approaches in group that we would loosely call psychotherapeutic, and uh, my program incorporates some of those some elements of psychotherapeutic approach as well as CBT. Um, the research on the effectiveness of these programs indicates that there's not a whole lot of difference between a Duluth model and a CBT model in terms of treatment effectiveness. There's some difference, and one recent meta-analysis did show that the CBT model is superior to Duluth in terms of reducing rates of recidivism. But there is also evidence from quasi-experimental studies finding that many of these Duluth programs are very effective in reducing recidivism. But these, again, are quasi-experimental studies, so the level of scientific rigor is not quite as high. More importantly, there's been recent studies that have looked at specific variables within groups as opposed to comparing one type of model versus another. So in particular, a motivational interviewing approach, one where the client is respected, is allowed to kind of figure out for themselves, uh, the answers rather than having the answers given to them, where the clients are treated with respect, and where the treatment does not proceed until the client feels that they have really keyed in to what the facilitator has been trying to tell them, and where there's a good facilitator and client alliance. Now, programs that incorporate some kind of motivational interviewing approach, those programs have been found to be superior to those that don't incorporate that approach. And we're talking about level one, the most rigorous type of research findings do support that approach.